The Ghana Police Service is saying one of the challenges that hinder the operations in effectively implementing the restrictions order in the 3-month timeline of the Act. Director of Public Affairs Superintendent Sheila Kese Abeye Bachman explained that the police is unable to take action once the duration of the law elapses. She was speaking at a webinar organized by the Ghana Journalists Association.
Ghana, in a bid to stop the spread of the coronavirus in the early days, introduced a range of safety measures and restrictions following WHO guidelines. Many of these measures were imposed under a new law, the Imposition of Restriction Act, passed by Parliament through an executive order by the President. While various stakeholders were all on board initially, lately, it appears law enforcement agencies at the pivotal point of enforcement have gone to sleep. The Director of Public Affairs, Superintendent Sheila Abeye Bachman, speaking on growing disregard for safety protocols, confessed the service was challenged.
The fact that the act was assented to by the President in March 2020, and you consider police powers in enforcing the protocols, then it means that every 3 months there was supposed to be an EI for the enforcement of the COVID protocols by police. The fact that at a point in time, police was asked to enforce A and B. So right now, if I see you not wearing the nose mask and I arrest you, what charge will I have to prefer against you? And then I take you to where? To the court. And then the court will also have to give the penalty. So the penalty of 12,000 minimum under Act 101, will it lie? And then under what law am I going to charge you with it? So I have said that police powers is about what the law authorizes.
Aside the law enforcement agencies, the advocacy initiative and social mobilization strategy for COVID-19 intervention by the Ghana Health Service was also challenged.
Ignorance is a factor. People are also afraid of even the vaccination itself. People are afraid when they wear the mask, they have a whole lot of challenges, they complain a lot, they cannot breathe and all that. And they also have misconceptions about the whole situation, the disease itself. And I think that's why we need to intensify our education.
The Ghana Medical Association is not enthused about the revelation by these stakeholders.
If that is the case, I would say it's rather unfortunate, because from the point of view of doctors, this disease is not over yet. We actually have a potential to go into a third wave, and we need to be careful. And we know we and as well as all other healthcare workers bear the worst brand of this disease. We are appealing, if there is any lacuna in the law that incapacitates our police officers to ensure that people obey these protocols, they should rectify it and empower the police to enforce it.
As at June 7, 49 new cases have been recorded, 1,103 active cases, and 92,552 recoveries and discharge, 789 deaths, and 94,444 total confirmed cases. The webinar was organized by the Ghana Journalists Association with funding from the Canadian government.